Hi guys, my name is Stephen Brett, and today I'm going to be talking about the physiological disorder haemochromatosis. So haemochromatosis, or as it is most commonly known, iron overload, is a physiological disease in which there is an excess amount of iron in the blood. This leads to the deposition of iron salts in tissues around the body, which can lead to liver damage, diabetes, and brown discoloration of the skin. Haemochromatosis is a hereditary physiological disorder, which means that if parents carry the abnormalities in a specific genome, then it is possible for the offspring to also carry that genetic abnormality. Iron is an extremely important trace mineral in our bodies and plays a very important role in keeping our bodies functioning and healthy. Red blood cells contain a protein called hemoglobin, which carries oxygen. The production of this protein is dependent on the presence of iron, and thus when there is a reduced or insufficient intake of dietary iron, there may be many unwelcome effects such as iron deficiency anemia. However, what happens when the body takes in too much iron? Well, the body itself has no way of excreting excess iron. Therefore, any residual iron that remains after hemoglobin production and other cellular processes is stored in the liver. Excess iron stored in the liver is a normal physiological process. However, it becomes a problem when there is too much iron being stored. Haemochromatosis occurs when there is an abnormal excess of iron introduced to the body. This surplus of iron forms iron salts in our body, which can damage tissue and important organs. Now, normal iron levels in the blood can be measured by the serum ferritin. If iron stores are high, then ferritin levels will also be high. The normal range is 20 to 300 micrograms per litre for men and 10 to 200 micrograms per litre for women. Anywhere above these levels is considered abnormal and a sign that haemochromatosis could be present. The small intestine is the organ responsible for absorbing dietary iron into our bodies. However, primary haemochromatosis occurs due to mutations in the HFE or high iron gene. If there are mutations on the C282Y or H63D HFE gene, then it is possible for the carrier to display signs of the genome. These gene mutations alter the absorbance of the small intestine to iron, which leads to a serious physiological problem. Diagnosing haemochromatosis is often very difficult for a number of reasons. The first being that early stages of the disorder may be asymptomatic. This means that there are no signs of the disease and it can go unnoticed. Secondly, when the disorder has time to develop and starts causing noticeable symptoms, the symptoms that this disorder causes are often very similar to more other common illnesses. Hence, it is often overlooked as a possible diagnosis. Such symptoms include unplanned weight loss, abdominal pains, joint pain, which often occurs in the fingertips, weakness and fatigue. Some more serious symptoms include liver dysfunction, sexual dysfunctions such as lack of libido and impotence, loss of body hair, and skin discoloration. The new medical discovery which has been utilized to treat this disorder is called iron chelation therapy. Chelation therapy is a treatment option that involves the use of specialized drugs that bind to metals in your blood and excrete them via urine. The medicine is introduced to your bloodstream either by an intravenous drip in your arm or can be taken orally by a pill. These iron chelators have side effects which can consist of diarrhea, vomiting, rash, and vision and hearing problems. However, the benefits greatly outweigh these minor effects. There are currently 2 iron chelators that are approved by the US FDA, which is the United States Food and Drug Administration. These are deferoxamine and deferoxerox. There is also another iron chelator that is currently for use in Asia, Europe, and Canada, but hasn't yet been approved for use in the US by the US FDA. This drug is called deferoperone. Many studies have since proven that iron chelators are extremely effective at reducing iron overload. Deferoxamine is the most commonly used iron chelator as it binds to iron at a 1:1 molar ratio, and thus it reduces its participation in toxic reactions in other parts of the body. Due to this recent medical discovery, leading to the production of this relatively non-invasive drug, this discovery has improved the standard of living for people around the world who suffer from this disorder, haemochromatosis. No longer do they have to undergo 2 to 6 venesections every year. Instead, thanks to this development, they just have to take a pill whenever their blood iron becomes too high. Ultimately, this research and discovery of a new treatment has had a huge positive impact on society, enabling people with haemochromatosis to become more active, have more energy, and enjoy their lives. Thank you very much for listening.